Three, two, one. Liftoff.
Welcome to the Ketamine Startup Podcast, and here today we're going to be talking about a frequently asked question: who can start a ketamine clinic? Ketamine therapy is growing in popularity, more people know about it than 2 years ago, 5 years ago. And so more people are interested in opening these ketamine clinics. And, it very much depends on a few factors who can open them.
And I do want to give you a disclaimer here that what we're going to be talking about today is just for informational purposes and is not considered legal advice. So please seek professional advice from an attorney in your state where you are opening your ketamine clinic, so you know their specific state regulations and rules and laws.
Yeah, we're just two doctors, board certified physicians that are sharing how we opened our clinic and the things that we've learned along the way. By no means does that make us an attorney that is familiar with opening medical practice in the state that you are deciding to open your medical practice in. So,
Totally. And we have a really good business attorney in California State. So we always rely on our attorney for legal advice. So let's jump into this. And as Kip had mentioned, the answer is it really depends. So mainly on two things. What state are you going to be opening up your ketamine clinic? Number one. And number two, is the person who's going to open up the ketamine clinic a licensed medical professional? So, um, let's talk about the states because this is a pretty important piece of it. Some states have something called the Corporate Practice of Medicine Laws, CPOM, which essentially means that a medical clinic needs to be owned by a medical professional, typically a physician. So, for example, in California State, any medical clinic that opens up needs at least 51% ownership by a medical doctor, a physician, and I believe the other 49% can be owned or partially owned by other medical professionals, such as an RN or um, someone else who's licensed. So, but the vast majority of the ownership needs to be the doctor. Whereas in Florida State, for example, anyone can open up a medical practice and hire physicians to work for them. So again, each state is different. Um, One example is in Washington State. So in Washington, it doesn't have to be a physician who opens it up. It could actually be a CRNA or a nurse practitioner who opens up their own practice. So this is kind of unique in the United States where some of these regulations and requirements are pretty state dependent. And again, this is the reason why it's important to have a business attorney who's familiar with the healthcare laws that you reside in.
and this is an ever-changing field too, as the mix of medical providers have changed, say from just the structure of how healthcare was built and how the pandemic has really shaken up those that are in the medical field. People are leaving, demand for healthcare providers is continuing to grow. And so the laws are changing as to who could provide a certain level of care. Before, things that were only something that physicians can do, more and more advanced practice practitioners are growing in their ability to do things. So then that could lead to changes in the state you're in that would allow someone else to open the practice. So again, these things change depending on what the laws are. And I think just the key, again, going back to connect with a attorney that knows what's up right now. Because there was, I think on the last ballot we had something about increasing the amount of autonomy that nurses could have here in California, to where it was much closer to that of like Washington State. And so then that would change who can open it, right? But going back to the whole knowing yourself, and we really stressed the importance, or encouraged the importance of partnering with people. If you're listening to this and you're in a state that is more lenient or less lenient, that might mean you need to partner with somebody who is a licensed medical professional. Partner with a physician. And hey, there's a lot of physicians out there that don't want to deal with the business end And so we encourage you then to partner with somebody that understands about business, or better yet, not just understand it, but loves it, finds it fun to do, all those things.
And now, a quick word for our aspiring ketamine clinic founders out there. If you've tuned into our episode today, chances are you're curious about the ins and outs of starting up a ketamine clinic. It's an exciting field, but let's face it, the journey from idea to actually opening day can be quite daunting. That's why we've created something special for you. Think of it as your personal roadmap, a free downloadable checklist that lays out the essential steps you need to consider when starting up your own ketamine clinic. This checklist is designed to help you avoid common pitfalls and launch your trajectory to success. So how can you get your hands on this checklist? Simple. Just visit www.ketaminestartup.com/checklist and grab your free copy today. We've made it easy and accessible because we believe in supporting our community with valuable resources. ketaminestartup.com/checklist. All right, let's get back to our discussion. Stay tuned and don't forget to download your free checklist during or after the podcast. So, you might be thinking about going back to the corporate practice of medicine laws. Some of the states that have the most strictest CPOM laws are specifically California State, New York, Texas, and Washington with the strictest CPOM laws. The ones who don't have the CPOM is Florida.
And so I think one of the biggest takeaways you can get from this episode is a understanding that each state is different. So you may have a colleague that was like, "Oh man, it was super easy. I just like opened it up." Or maybe somebody you went to college with who went into business and was like, "I opened up a clinic in Florida and you're practicing in Texas." As an anesthesiologist, yes, it's going to be a different experience for you because there are different laws. And so, just again, partnering with people, we're all about keeping overhead low, but this is one area you do not want to scrimp on and save. You want to find a person that really knows their stuff about the laws in relationship to opening a medical practice in your state.
Yeah, it kind of reminds me of some of our patients who may come in and do an entire Google search, and then now they're the expert in a disease. And it's like, yes, they know a lot, but no amount of Googling is going to replace your professional medical expertise. Similarly, someone can Google a lot about state regulations, but they're not going to be the expert, right? And so we know this applies to us in the professional space, in the medical space. That also applies in the legal space. I do want to note that there is one workaround that I just want to touch upon. And the workaround for the states that we had mentioned that have corporate practice of medicine laws, there's something called a management service organization, MSO. And what an MSO does is they help a clinic and do the marketing, the HR, the operations, but they don't play a role in directing how that doctor practices medicine. So these CPOM laws were really designed to keep patients safe. They didn't want business professionals to like direct patient care. Now, again, this workaround is where the doctor would open up their own clinic and then create a contract with a management service organization through a management service agreement so that they're not doing any of the medical clinical stuff, but then they're kind of supporting in that administrative aspect. So that is one workaround because you may be living in a state with really strict corporate practice and medicine laws, but then you're like, well, it looks like they have other people running it. It's probably not. They probably have a management service organization with a management service agreement and where they're doing all of the background administrative side, but not directly impacting the patient care.
And you're probably familiar with management service organizations. If you're working for a large hospital system, they have a management service organization doing all of that. That if you ever, went to HR and they tried to explain the organizational tree, the org tree, and you're like, wait, or you were working with a colleague in a different department and they're actually part of a different branch, like where I was working at before, the physicians were we were employed by one group and then the nurses were employed by another group, but then the non-technical staff was employed by the MSO. It was very confusing. So you're probably already working with some or rubbing shoulders with individuals. This, what we're sharing is how it's almost done at a more simpler micro level, I guess. From a very straightforward standpoint of somebody that would have do just all the hiring for your staff, or doing the onboarding, doing the marketing, doing the customer service aspects, but for your potential future ketamine clinic, and that the physician, the licensed medical professionals in your future ketamine clinic would be a separate entity with that, but then contract. And so that's a way that if you're listening to this podcast and you're not a licensed medical professional, or you're in California, let's say, and you're like, I really want to open up a clinic, and now you're telling me I can't. Well, we're telling you the workaround. And there's a lot of, you're probably going to be familiar with these clinics that have like multiple locations, but are under the same brand. You bet, they are definitely functioning with an MSO.
So, one example of this is when I used to work in the emergency department in California State. It was run by a large corporate management organization, so a large emergency medicine group. It was a nationwide group, and they were kind of the MSO, where they did all the malpractice side, the administrative side, the marketing, hiring, HR, all of that jazz. And then they said, oh, yeah, well, the physicians are separate and we're contracting with them. So we do see it not only in the ketamine clinic side, but in the emergency medicine world, in the anesthesia world, because that is possible. And it's interesting because I have seen a lot of private equity starting to enter healthcare, where they're buying out dermatology practices, ophthalmology practices, etc. And then they'll become a publicly traded organization. They'll get on the stock market. So it is interesting, this intersection of the business world with the healthcare world. And I think it's fascinating, which is one of the reasons, when I was in med school, I actually got an MD, MBA, because this unique intersection of medicine and business is really fascinating to me.
So, in a nutshell, here, who can open up a ketamine clinic? It depends. Depends on if you're a licensed medical professional or not, and what state you want to open up your ketamine clinic. End of the day, you want to partner with and hire an attorney that knows everything about opening a medical practice in that state that you're in. And just, be aware that this is an ever-changing landscape, and, that there are options if you find that it is, difficult at first, based off of, whether you're a licensed medical professional or not. And, you can always utilize an MSO if that is a workaround that you need to do.
All right. Thank you so much for listening. We really appreciate your time. Do me a favor and subscribe on your platform, whether you're using Apple Podcasts, Spotify. Please give us a 5-star rating review. This is, one of our earlier episodes. So we're brand new. We're baby podcasters. So your support and your contribution and acknowledgement really means a lot to us, and it does make a big impact. We read each and every one of our reviews, and would really appreciate that. And please stay tuned. We will keep posting podcasts. We're really excited about this venture, and it's a lot of fun. So stay tuned and take care. Bye-bye.